Hi everyone, in today's video we're going to discuss a triple track case scenario for RN, LPN, and HCA in a sample case scenario and your main responsibilities. So let's get started. For our case scenario, we have Miss Linda. She is a 76-year-old female with CHF and diabetes. Mrs. Linda Carter is a 76-year-old that's been admitted to the long-term care facility following multiple hospitalizations due to CHF and diabetes, and it's uncontrolled. She has a history of hypertension, chronic kidney disease, which is stage 3, and a mild cognitive impairment. She is on furosemide, metoprolol, insulin glargine, and ASA or aspirin. She has a bilateral lower leg edema, which is pairing plus 3, shortness of breath on exertion, and occasional confusion. She has recently developed a stage 2 pressure ulcer on her sacrum and has been increasingly fatigued, refusing meals, and complaining of dizziness. Just reading this case scenario, if you are doing your assessment, the first thing that you need to do is pick out the key information that will affect your patient's care. So again, it depends if you are the RN or the LPN or the HCA. So for nurses, if you're the RN and LPN, key information that you need to remember would be the patient's main diagnosis. So in this scenario, it would be the patient's CHF and uncontrolled type 2 diabetes. The patient history is also good to know. The patient's hypertension, CKD, which is stage 3, and mild cognitive impairment. Again, if you're the one giving medication, you're the nurse, RN, and LPN, you need to know the medications, but not only the medications, but also side effects, right? So the patient is on furosemide, metoprolol, insulin, and aspirin. And if a patient has any other PRN medications, those are key information that you need to know as well. Lastly, would be the patient's main symptoms, the patient's current symptoms, because again, that will affect your overall treatment of your patient. That will determine if you're doing a head to toe assessment or a focus assessment. For healthcare assistants, right, for HCAs, that will affect how the patient will be able to do ADLs. So in this case scenario, the patient is having shortness of breath on exertion. The patient has lower leg edema. The patient also has occasional confusion, has stage 2 pressure ulcer, increasingly fatigued, refusing meals, and complaining of dizziness. So this is when critical thinking will come in. You need to start thinking what type of interventions, right, I need to do for this patient, but also what type of assessment I need to do with this patient, right? Would this patient be able to tolerate a full head to toe assessment, or I need to do a focus assessment and I need to give interventions right after that? If you're the HCA, you're already thinking, would this patient be able to tolerate the ADLs I will be doing with her? The patient is refusing meals. How can I encourage the patient to increase the patient's hydration and the patient's eating habits, right? In terms of imbalance of input, right? You need to monitor that as well in the patient's output. So there's so many things here that you do need to remember. And again, it depends on if you're the RN, LPN, and HCA. So let's get started and talk about the responsibilities. So if you're the RN, you're the registered nurse, your main responsibility would be to conduct a comprehensive head to toe assessments. But again, using critical thinking, you have to decide in this case scenario, in this moment, would the patient be able to tolerate a comprehensive head to toe assessment, right? Or maybe I need to do a focus assessment as I need to manage the patient's symptoms. So I need to do a focus assessment, right? For example, a cardiac assessment or a respiratory assessment or a neurological assessment, right? Depending on the patient's current symptom, do that focus assessment and then provide the intervention. Again, a reminder, before you do any interventions, before you give any PRN medications, you need to do your assessment first. Next, your responsibility would be to monitor fluid balance. So you need to take the patient's weight, Patient has edema as well, bilateral edema, so you need to do some assessment on that. You need to do a respiratory assessment, so listen to the patient's lung sounds. Listen if there's any fluids, right? The patient has CHF. If there's any crackles, then that means there is fluid in the patient's lungs. And also, you need to assess the patient's urine output. Next, depending if there's an RN and then there's an LPN. So if there's an LPN, usually the LPN gives the medication, the scheduled, and sometimes the PRN. However, if there's no the LPN is not tasked to give the medications, the RN is the one giving medications, that would be your responsibility. And it's not just giving the medication, but also knowing, evaluating the effectiveness of the medication and the side effects. For example, hypotension, right, might happen if you give metoprolol and furosemide. So maybe you need to do a blood pressure check first, right? You need to do vitals first. That's something that you need to be thinking about. Next is creating care plans. As the RN, right, your responsibility is to create a care plan and to adjust the care plans if there's any alterations, any changes in the patient's condition, in the patient's status. And you need to communicate that with the interdisciplinary team and also the physician. So if you have concerns about dizziness or the patient's confusion, or a patient's exacerbation of CHF, for example, or dehydration, or the patient is continuing not eating and refusing meals, that's something that you need to bring to the physician, right? Lastly, would be delegating tasks to the LPN and the HCA while ensuring safe patient care. So you need to know your scope of practice and what you can delegate and not delegate to LPN and HCA. And again, you need to document, ensure you are documenting throughout your shift, right? You are documenting if you're giving medication, or if you're doing any intervention, your assessment, if you're taking vitals, and all that. Now let's move on to the LPN responsibility. For the licensed practical nurse responsibilities, your main responsibility would be to perform a focus assessment. Again, if a patient is complaining of something, right, the patient has symptoms, for example, shortness of breath, right, then you need to do a respiratory assessment. If the patient has confusion, you would do a neurological assessment, right? If you're doing wound care, then you need to do a skin assessment. This patient also has diabetes, so before giving insulin, then you need to take the patient's blood sugar, right? Next, talking about medications, you need to administer scheduled or routine medications and PRN medications. Again, if there's any medications that maybe you need to take vitals first, right? I was talking about metoprolol, so you might need to take a blood pressure first, right? Because you need to make sure the patient's blood pressure is not too low to give this medication. For the patient's insulin, you need to take the patient's blood sugar first, right? And you need to monitor also the patient's condition, okay, after giving PRN medications. And again, a reminder, before you give any medications, any PRN medications, right, for interventions, you need to do your assessment first, a focus assessment. So the difference between head to toe assessment, just to give you an overview, if a patient is stable enough to do a head to toe, a comprehensive head to toe assessment, that's when you would do a head to toe assessment, right? A full head to toe. But if a patient has a symptom that you need to manage right away, then you would do a focus assessment. Okay? That is the difference between the two assessments. Next, as the LPN, you also need to do wound care based on facility protocol and the RN direction. So make sure you communicate that to the RN, and sometimes as well, a wound care nurse has a protocol for specific wounds. So again, depending on the case scenario, but every time you're doing wound care, make sure you are following the protocol. Lastly, report any changes. So you need to be communicating with the RN regularly, right? You guys are working as a team, so you need to report any changes in the patient's condition or status any alteration. So for example, worsening edema, the patient's confusion is increasing, the patient's meals, right? The patient is not eating her meals for breakfast, lunch, and dinner, or not drinking, or anything like that. You need to communicate that to the RN, and the RN will communicate that to the physician. Let's move on to the healthcare assistant responsibilities, or the HCA. So in this case scenarios, your main responsibility as a HCA will be assisting with the ADLs. So if you guys can remember, I said in the beginning, right, as the HCA, you do need to know the patient's condition. How is the patient feeling during that shift, right? Because that will affect the patient being able to tolerate ADLs. That will affect if the patient is able to tolerate bathing, right? Or dressing, repositioning, right? So that's something that you have to remember. You don't have to remember the pathophysiology of the diagnosis, but it's good to know why the patient is there, right? So maybe the patient has hypertension, or the patient is having shortness of breath on exertion. So what you need to do is make sure you don't push the patient too hard. Make sure you give the patient break in between ADLs, right? If the patient is bathing or dressing or things like that. Next would be encouraging the patient's hydration and meal intake while also monitoring for aspiration risk. As the HCA, you will be the one assisting the patient with their hydration, but also with their meals. So you will be feeding the patient, right? What is something that you need to remember, right? What do you need to monitor? So aspiration would be number one. Next, observe and report changes in skin integrity, appetite, and mental status. So you will be the one spending a lot of time with this patient during ADL. So you will notice the patient's skin, right? Or the patient's mental status when you're talking to the patient, when you're asking the patient to do some things. And make sure you communicate that to the LPN, right? And to the RN as well. And then it's the LPN, the RN's responsibility to create the care plan around that and communicate that with you as well if there's any changes with the patient's care plan. For example, there's any changes in the patient's mobility, right? So instead of a one person assist, now this patient is a two-person assist. So you guys are all working as a team. Next, supporting mobility efforts to prevent deconditioning of the patient would be another responsibility for the healthcare assistant. In conclusion, any changes, alterations, and updates regarding patient status needs to be communicated to the physician and the interdisciplinary team. And together as a team, that's when you will come up with a plan in terms of patient's care. You're the RN, LPN, every time you're doing an assessment, you're taking the patient's vital signs, you're giving any medications, ensuring that you are doing your proper documentation, you are filling out the flow sheet. If you're giving medications, you are doing your initials and the time you gave the medication, and also observing, right, the effectiveness of any interventions you have given. Next, always do your assessment prior to giving any treatment or intervention. So again, please remember that when you are doing your tests or any assessments. Next, patient teaching, if patient is able to tolerate. So if the patient is able to tolerate it based on their energy levels, based on their symptoms, then you need to do some patient teaching as well. Next, know your scope of practice and practice standards. So again, if you're doing the triple track case scenario, you need to know your scope of practice as the RN. You need to know your scope of practice and the practice standards as the LPN and also as the HCA. Because, for example, as an RN, you need to be able to know what to delegate and not to delegate. And the LPN and the HCA, you need to know your scope of practice, because what if the RN is delegating a task that is outside of your scope of practice? It's your responsibility to say to the RN that that is outside of my scope of practice, so I cannot perform that task, right? And that's it for this case scenario. Please let me know in the comments below if you found this helpful and if you want more case scenarios like this one. and get in touch. So go to the nursingcollective.co for more resources like this one, and stay tuned for more videos like this. Thank you guys for watching. I'll see you in the next video. If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video.